All right, so this is such an important topic, so please gather around and listen here with me for a few minutes. You know, women over the age of 45 are definitely more prone to menopause symptoms, and there are a lot of questions out there surrounding different treatment options, but also a lot of risk factors when it comes to different treatments. Well, with us today is Dr. Alexa Fifik, who is here, an expert and a doctor who specializes in menopause, and is here to explain some of the best options that might be best for you. First of all, welcome. It's a treat to have you here because I know Jennifer Jordan here on Fox 8 has done a story with you. I've read a lot about you. You've been on national news recently too. So you're a leading expert in this. And I know when my mom went through menopause, it was taboo. When my grandmother, for years you didn't talk about it, and family members didn't talk about it, and then it was always the change, and then it was people would roll their eyes. It's different now, thank God, that now the medical community is recognizing it more and coming up with different treatments and options, and you can talk about it. So talk about where we are with menopause at this stage, and actually to the different phases of menopause.
Yeah, I love that question. Also, thank you for having me.
You're welcome.
So I think it's been a very taboo topic for a very long time, and fortunately, you see a lot of different social media advocates, as well as physicians and other clinicians advocating on social media and a lot of other reachable places to talk about menopause, perimenopause. Unfortunately, only about 11% of women that qualify for menopausal hormone therapy still actually get it. So while I'm very, very excited that it's improving, that number still tells me we have quite a way to go. And so you mentioned the different kind of stages of menopause.
Right.
Average age of menopause in the United States is about 51, 52 years old, but natural menopause can occur anywhere between 45 and 55. Under those age ranges, between 40 and 45, we call that group early menopause, and it can occur in patients less than 40, which we call premature. After kind of 55, 57, we call that late menopause. The oldest patient I've had who finally became menopausal was 61. So it's very variable.
So what qualifies with menopause? Is it your menstrual cycle? Is that like the main kind of factor when you start losing that?
Yeah, so menopause by definition is going 12 whole months in a row with no menstrual cycle. Realistically, that is kind of preempted by perimenopause, which can be multiple years of changes in menstrual cycles past kind of our reproductive years. And that time frame by itself can be associated with a lot of menopausal associated symptoms like the hot flashes, night sweats, mood changes, weight gain, joint pain. I could go on. There's hundreds of symptoms.
Right, yes, there really is. So what are the treatment, where are we on treatment right now? What are the best treatments? I read a lot about synthetic hormones, seeing a lot about bioidenticals. Can you address that, and like what's best for women, and is it just kind of an individual situation?
Yeah, I love that question because it's so prevalent in every conversation I have every day with patients. The kind of term bioidentical is actually a marketing term. It doesn't really hold any kind of ground in the medical community. And what it really is trying to talk about is hormones that are made in a lab but are identical to what your body would produce. And so the gold standard for menopausal treatment is menopausal hormones. That can range from things that are truly synthetic, made in a lab, and don't have any body identical equivalent. The body identical or bioidenticals, which match the chemicals that your body makes, or natural things like conjugated equine estrogen that come from other natural sources. And each individual woman is different and may need a different version of those. So it's really specific to each individual patient.
I've read too that then you get afraid because you see that maybe some of these hormones can increase your chances of cancer. Then you think, okay, don't want to do it. But then you also, I've read that maybe some of it, you need it, women do for beneficials of your heart, that you need that as kind of something that can help you. So I think it just seems so confusing.
It can be really overwhelming for the average consumer, and I think that's why there's a lot of predatory practices out there, predatory things on social media, because there's data that has been kind of trailing along with us for the last 20 plus years that it causes cancer or blood clots or strokes or those things. But and menopause experts know when to use the right thing for the right person, which means that it's safe. We don't recommend things that aren't safe to patients if it's the right person. And kind of making that decision if you're the right fit for it with your individual clinician is something that every patient should get the option to do.
For sure, great information. And if your doctor's not bringing it up to you, you need to make sure you bring it up to your doctor. And if you don't feel comfortable, you need to seek out a specialist like Dr. Pfiffick. I mean, I think this is your area that you specialize in, and you know all of those questions and all of the different treatments, including pellet treatment and all of that. We've run out of time, but there's also some great resources out there too for people, so make sure you get out there and try and find it. Dr. Pfiffick, you're amazing. Thank you.
Thank you, Stephanie.
I need to schedule an appointment with you and help me guide down that journey. Thank you. Appreciate it so much. All right, we are going to take a short break. For more information on menopause, premenopause, all that good stuff, go to fox8.com. We're going to take a short break. You are watching Fox 8 News in the Morning, and we'll be right back. Stay close.